Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hip. It is the Fulcrum test. This test came from a paper in 1994 by Dr. Alan Johnson, and the purpose of this test is to diagnose a femoral shaft fracture, or just a fracture in the femur. And they developed this test by looking at some athletes who had like a general anterior thigh pain, and they noticed that when they sat on a chair with their leg dangling down, it was a little bit more discomfort. So they said, well, if we develop this test from that, it can be an early way to detect if somebody has possibly like a stress fracture that won't show up on radiographs. To perform this test, you have the person seated with their legs hanging off the edge of a table. What you do, you're going to place your one arm under their thigh, hand onto the other thigh. So as you see, you're creating a fulcrum right there. Then all of you do is press down on the knee, apply that little bit of that downward pressure. And a positive is a pain. Now you can move your hand up or down into the suspected area to test it. In the original paper, the author said that this produced a sharp pain. It also had apprehension from the people being tested. So there you go. That's how to perform the Fulcrum test. For the research on this test, there's not a whole lot out there. It is referenced quite often in terms as a screening tool for the hip or thigh, to utilize that with people that come in with any pain there, just to rule out a fracture. And if it's positive, like, oh, send them off for a radiograph just to rule out a fracture. In terms of like the sensitivity and specificity, there are two articles out there on it. First is the original paper, and it found a sensitivity of 93% and a specificity of 75%. A later article did look specifically at female lacrosse players, and it found that it has a sensitivity of 88 and a specificity of 13. Very interesting thing that came out of there is they really promote that, you know, your female athletes coming in with a pain in the thigh to really perform a good examination, and because they were kind of looking all across the board of injuries in female athletes. So it's actually a pretty interesting read. So anyway, there is the Fulcrum test. Let me know, what do you think of this test? Do you utilize it? Have you ever heard of it? Do you think we need to do some more research on this? Let us know down in the comments. And of course, like always, take care of yourself, take care of your patients. We'll see you then.